Dr. Chen Li, emergency physician from Taiwan, hosting Emergency Medicine Resident Network, a Facebook group-based group focusing on networking of emergency medicine physician residents networking in Taiwan. It's our pleasure today having Dr. Alicia Kurz with us, the president of EMRA, okay, and sharing her valuable experience on leadership and emergency medicine training. Okay. Dr. Alicia Kurz is currently PGY4 resident in UCSF Fresno and the president of Emergency Medicine Resident Association, the largest and oldest independent resident association in the world, founded in 1974. Okay, so welcome, Dr. Alicia
Thank you.
Kurz.
Thank you so much.
First of all, I would like to thank you for accepting our invitation and making this interview possible. Since the schedule of the EMRA board is very, very tight in the ACEP conference. Okay. So first of all, can you tell us about what's the challenge and rewards of being the president of EMRA?
Yeah, absolutely. So being on the EMRA board is an extremely time-consuming commitment that we make. We travel a lot, mostly to attend meetings like this. So we're here at ACEP. You know, we go to the SAEM, or Society for Academic Emergency Medicine conference. Our presidents, there are 3 of us. So you go president-elect, president, immediate past president. It's a 3-year commitment. We go to many others. So EVPMA, which is an association of all the big emergency medicine organizations like CEP and EMP that employ doctors here in the U.S., kind of all over. So it's there's a lot of giving up your personal time to do these things, but and then of course all the preparation and everything that goes into being ready for those conferences. But the rewards they far outweigh the sacrifice that you make. You get to interact on a regular basis and get to know leaders and forefront thinkers in emergency medicine from all around the world. I mean, here we are, you know, sitting together, but we interact regularly with the ACEP board and with the boards of these other, you know, very influential organizations. And then even just getting to know the other board members. These are all very driven, you know, current and future leaders of our specialty that have all become your good friends, you know, through the process. So being able to be involved in what's going on and cutting edge in emergency medicine, and being able to put that, what can be very daunting shift work in the context of your greater specialty all the time, you know, it makes going to work every day more meaningful, and the rewards just far outweigh any of the personal sacrifice.
So I think the task of being the president of EMRA is very demanding.
Yeah, it is.
So how do you balance your public service, like being the president of EMRA, and your clinical training, and even your personal life?
Yeah, absolutely. So I'm married. My husband's name is Austin. I'm just kidding. And so we don't have any children, which I think, you know, but there are board members that do have kids and families. So when I first was running for the president, I had to sit with my program director. His name is Jim Gomez. He's a ridiculously supportive individual. He's, you know, all about building young leaders and wants us to succeed and make a difference in our specialty. But we had to have an agreement that, you know, first and foremost had to be my clinical training. I can't go be a leader in a specialty if I don't have a solid found of clinical knowledge and I'm not a good doctor, right? So I always have to kind of remind myself of my priorities. Number one being a resident. And so I work the same number of shifts as everybody else. I don't, you know, work fewer or anything like that. I work the same number of hours. I push myself really hard to make that the priority. You know, and then really it's just, you give up a lot of your personal time. So I don't have a lot of days off that are truly days off. I don't sleep that much. You know, I'm kind of a 4 to 6 hour a night kind of person, because that's just the way it is, which for me is functional until your voice sounds like this from being in Las Vegas for too long. But I think when you love something and it's meaningful to you and it's fun, which you should never do leadership if you're not actually really enjoying it. But when it's fun, it's not hard to give up your personal time, because it feels like a hobby. So it's a job, but it's also something that I choose to do and that I am happy investing in. But you know, you don't spend as much time hanging out with your friends. You don't spend as much time I don't watch TV. You know, like I've never caught up on anything pop culture related because I just don't have time, and that's okay. For me, that's a choice, and I love it.
Yeah.
I'm so happy with how I spend my time. But you do give up. You kind of give up a lot because just being a resident alone is as you know, a ton of work. It's a ton of work. Yeah.
Okay. So do you have any suggestions to the EM residents on how to prevent burnout
Yeah.
and enhance their awareness?
Absolutely.
In a stressful clinical training environment.
Wow. So right now, I think physician wellness and burnout is it's a huge issue. It's finally, you know, thanks to people like Jay Kaplan, the outgoing president of ACEP, and some other great leaders is being brought to light. We're paying more attention to this very important issue. But I think that you can't just be a shift worker in emergency medicine. I think that will burn you out. I think the especially here in the U.S., our system is pretty rough on us. You know, we don't always have the resources or the backup that we wish we had for our patients. And that alone can be very frustrating and really wear you down. The shifts are busy. We see high volumes of people. You're on your feet the whole time, and then dealing with a medical record, et cetera. So even if you love your job as an emergency doctor, just working shifts can be too much on your wellness. So I think investing in something like EMRA or having another way to engage more in your specialty, getting on a committee in your state or your, nationally, being involved in things the hospital is doing to make your system better. Really investing in the big picture things helps keep that shift work in perspective and re-add that meaning behind what you're doing. Whatever it is that brought all of us to emergency medicine in the first place, helping you remember that. And then I know I just said that I don't do this, but you do have to take time for yourself. Setting aside time to run or sing or play an instrument or just lay on the couch and do nothing, or cook or whatever it is that's non-medical that you enjoy. I think you have to intentionally make time for that. I think the other big thing that we need to do that we don't do as well is take time to share our experiences that are harder with each other. I'm not sure how it is in Taiwan, but in the United States, definitely medicine has a culture where we don't talk about our feelings very readily, particularly in procedure-based specialties like emergency or surgery. And I think that that's wrong. I think that we see too much tough stuff. We see kids die. We see young people, get very seriously injured and become paralyzed. We see, even older people, but who are just lovely and sweet, who have families that love them, come in and get very sick from things like pneumonia or whatever. So that is hard. The emotional burden is hard, and we don't take enough time to process those experiences with each other, and I think we need to be more intentional about doing that.
Yeah, I think that's the same in Taiwan.
Really?
Yeah, we really share this kind of stressful experience.
Yeah.
Yeah, this hard time.
Right.
Yeah.
Right.
Yeah, it's the same in Taiwan.
Yeah, and I don't know why, generally I think there's this perception that being emotional is being weak. And I think that that's wrong. I think that we need to, work together as young physicians to kind of change that tide, but change that culture as we progress in our careers to make it more normal. Our residency started doing this really cool thing. In the U.S., there's a radio station called NPR, National Public Radio. It's mostly just like news highlights and some talk shows that I really enjoy, but a lot of people think are very boring. But they do this one programming called The Moth, where they bring in, authors and speakers and stuff to just tell a story about their life and something that they learned from it. So my residency kind of mirrored this and developed a lecture series where our PGY4 residents give a 10-minute talk about something that happened to them during residency that affected them personally. And it could be about having a baby or, getting married, or it could be something rougher, like the first time a patient died or the first time they felt like they made a huge mistake and it negatively affected a patient, or seeing a young patient die. Things that are a little harder for us to process. And then we break into small groups and we talk about that topic as a group of residents. And you meet with the same small group every month when we do this. And I've noticed that it's really helped people be more open about what they're feeling and going through during their shifts. It also seems to have helped build tighter bonds between residents who are now getting to know each other on a very different level than they were before. So we need more things like this, and we need that to be normal, to be the norm across the board in emergency medicine. And right now it's not. Yeah.
That's a good goal to encourage the networking, not on the base of the clinical base, but more personal,
exactly.
emotional support.
Absolutely. And in the U.S., and I think actually, I'm sure you could access this from just about anywhere, but there's a Facebook group called EM Docs. I don't know if you guys have heard of this. It was started by a woman in ACEP. Her name is KK Moody. And it's kind of it's a doctors only group, and it's just a space to process things like that. So people will talk about an airway they couldn't get and how that really hurt them, or they'll talk about something funny or something sad or something just powerful that happened at work. It's kind of a very safe space online for physicians from around the world to connect with those experiences. So that's a really good first step, is getting all of us engaged in that, even an online community, and just making it normal to share those experiences.
Yeah. Okay. So how about a little bit about social media or the phone?
Yeah.
Right? The phone, the
Phone.
free
Oh,
open
phone.
access medical education.
Yeah.
It's very popular and rapidly growing in medical education,
It's blowing up.
especially in emergency medicine. I
Right.
think. Yeah. So do you have any tips on how to pick up the most valuable materials, study materials from the overwhelming materials within social media, and how to balance with the textbook reading and journal article?
Right.
Yeah.
It's you ask an amazing question. It is certainly impossible, right? It's we use this phrase all the time. It's like drinking water from a fire hose, right? So it's just like it's way all of this coming at you, and you can only get this much, and you're like, where do I put, myself? I think it's important to realize that everyone learns differently, and that what works for one person isn't going to work for you. And it takes time, but I think you kind of have to figure out which resources tend to put the information more sticky in your brain, and then stick with those and be okay cutting off the rest of it. I think that's the biggest struggle, is that I feel a ridiculous amount of pressure to try to read all of the things. You can't, right? Like just reading an EM textbook is an extraordinarily time-consuming process. And keeping up with every single blog or every single phone med, there's no way. There's just no way. But there are some people who seem to find the time to do this and make the rest of us feel like we're not doing enough. So I personally love using phone med on shift. I'm a big fan of, I'm looking at this EKG. I'm pretty sure this is benign early repole. It's been a while since I've looked that up, so I'm going to go to, Life in the Fast Lane is a really popular one. I'm going to go there. I know that he has a great page on benign early repole. I'm going to read that real quick, less than 5 minutes, and then go back to my shift. So I think phone med is great for those, 5-minute windows here and there where you need something quickly. I don't think a textbook serves that purpose. I think a textbook is better for particularly younger residents to kind of set up a schedule of, I'm going to try to get through this book once or twice in my residency, and kind of stick with a more regular reading schedule. That said, like, full disclosure, I don't read textbooks anymore. I do once in a while if I'm preparing a talk or whatever, but that information isn't sticky. It doesn't stay in my brain. I'm way more reliant on sort of the phone med 5 minutes here and there. As an intern, I definitely tried to use, the textbook, but it's hard. It's really hard. And then, and then podcasts is the other big area, right, in phone med. So EMRA, which isn't technically phone med, but EMCRIT, there's like all these, very popular worldwide podcasts that take hours to listen to also. I'm not an auditory learner. They do an amazing job, but I don't spend a lot of time in my car, and I'm not an auditory learner. So I had to kind of be okay cutting that out. And so I think the only tip I have is spend some time getting to know each of the resources. If it doesn't work for you, let it go. And that's okay. You can break up with it. You don't have to stay married to every single resource, and stop comparing yourself to what everyone else is doing, because you'll always feel like you're not doing enough. But yeah, and then we have on our website a page where we've listed sort of the resources that our residents like the most. So that'd be a good starting place. So go to the EMRA website, look at the recommended resources page, and start with those, and kind of see where you land after that.
So try to know yourself, your
Yes.
own learning style.
Yes.
Yeah.
Which takes time to learn, maybe.
Yeah, choose the best for yourself.
Yeah, and then cut off everything else. That's okay. It's okay to not read every single thing that gets put out there about emergency medicine. Yeah.
Okay, so how about let's talk a little bit about EMRA.
Yeah.
I know EMRA is the oldest and largest independent resident association
It
in
is.
the world.
Yeah.
And so what's the advantage of being an independent resident association
Right.
instead of being a section or committee of an emergency physician society or association?
Sure, like ACEP or SAM or something. Yeah. EMRA is, so we crested, we're more than 15,000 members, so we're very, very large. That includes over 90% of the emergency medicine residents in the United States. So that's a huge number of people. And in that light, being our own organization allows us to truly say that we represent the voice of EM residents in training in the United States. By being independent, we can really stand up and say that that is true. I have no other mixed interests, right? Our organization, EMRA, is not a part of ACEP. It's not a part of SAEM. It's not a part of, CORD or any other organization, such that we don't answer to anybody but our own members. And so being able to say, this is what's best for our membership. This is what's best for our residents and students. And that's the only focus that we have to have. That allows us to be very intentional about where we put our time and our financial resources. And I think it also helps us just stay nimble. We don't have to ask for permission from a lot of different entities to do something. We can just say, we want to do this for our members, and then we can just get it done. So it helps focus our mission. It helps us stay centered. It helps really, when we say we are the voice of residents, we are. I mean, that's what we represent as residents and medical students and nobody else. So I think that's a pretty powerful position to have. And, with over 90% of the residents in the U.S. being in EMRA, it really gives us that clout to say, yes, we do represent them, and that's the only body that we're going to represent, and it's a unified and definitive voice.
Okay. And the members of EMRA were physically separated.
Yeah.
Yeah, and they were very busy.
Right.
So how does EMRA enhance the members' engagement?
Yeah. This is something that we actually struggle with on a regular basis. Our members meet twice a year at ACEP here, and then at SAEM in the spring. And there is clearly this uptick in engagement and activity once people have spent some time together in person. Seeing people face to face and interacting is very energizing. So we have this, flurry of activity, and then we go 6 months really struggling to keep people plugged in and engaged, which is important to do, because if your members aren't engaged in your organization, then what's the point of having an organization? So EMRA has been very intentional about trying to create ways to, in real time, continue interacting with our members despite our geographic differences or how spread out we are. A really good example of this is, have you heard of Google Hangouts?
Yep.
So we use a technology that's similar to that to set up EMRA Hangouts. And so, for example, we've been doing it for our medical students, where we get a couple of EMRA-friendly program directors from the United States, and they sit, and then we get some medical students from all over, all together in this hangout environment online. And they do a real-time kind of advising session. Other students can, anywhere they are, watch this in real time and submit their questions in text form, or the whole thing gets recorded and then posted to the internet, and it can be watched, later by a student that wasn't able to be there in real time. We're looking at expanding this hangout model to include, recommendations on getting ready for and applying to fellowship, or navigating FOAMed and figuring out how to use those resources, or becoming for example, a female leader in emergency medicine. There aren't historically very many, but right now we're in a really neat time where ACEP, SAEM, CORD, EMRA, AAEM, RSA, their resident association, all of those groups have a female president right now.
Yep.
So we're looking at having a joint hangout with a lot of those female leaders to talk about what's it like to be a female leader in EM, and what are the strategies that you employ to succeed. So, it's not easy keeping people engaged, but I think using more cutting edge and more forward thinking technology to plug people in and let us interact face to face despite our distances. Yeah. is something EMRA has been trying really hard to work toward. I think we're doing a good job. I think we have a long way to go, but it's been working so far. So.
Okay, so when it comes about the collaboration, so as along with the development of emergency medicine, there are other groups such as the Resident and Medical Student Advisory Committee of SAEM and AAEM Resident Student Association, and even I think Young EM Doctors section of the European. European Society of Emergency Medicine, and even social media-based group like Academic Life in Emergency Medicine and other social media. Other groups are also focused on the enhancing the welfare of the EM residents.
Right.
So what's the strategy of EMRA to collaborate with these entities to enhance the welfare of EM residents?
You know, it's tough because you have to, as an organization, right? One of the most important things for us is having members, because if you don't have a membership, then you don't represent anybody, and you lose your relevance. And so sometimes people think that these other organizations are like competitors with EMRA. In the sense that we all want the same members, that's kind of true. But I think that EMRA is very good as a board and as an organization at realizing the power of collaboration and how much better we do together than we do separately. EMRA facilitates relationships with a lot of the organizations that you named. So just tomorrow afternoon, we are going to sit down, the board of EMRA, the executive board, with the president and the executive board of AAEM RSA, to talk about ways that we are working on maybe similar projects and how can we not duplicate our efforts and work together to make something better instead of two things that aren't as good. We just March, sat down with the leadership of ALIUM, Academic Life and Emergency Medicine, talk about finding ways to collaborate with them. We did the same thing with HIPPO-EM, which is used to be the same people that do MRAP, but they've kind of divided in a good way because they were too big now. But talking about with HIPPO-EM, how do we get engaged with what they're doing to educate residents and frankly all of emergency physicians with better, kind of more new, forward-thinking educational strategies. EMRA is very good about reaching out, extending the olive branch, trying to form good relationships with other organizations and figure out how we can work together. There are some things in which EMRA stands alone, and we really do our own representation of residents to some of the bigger House of Medicine organizations. But when it comes to ground level projects, making resources that residents need and want, there's no reason that we can't collaborate with these entities who sometimes do a better job than we are. And maybe that means instead of making our own, we look at what ALIUM is doing and we promote their work and we say, hey, we found this, it's great, we want our residents to have access to this. Or we go to HIPPO-EM and we say, what you're doing is amazing, how do we negotiate a deal to make this a benefit for our members? Or we go to AAEM RSA and we say, what are your focuses, what are ours, where do we overlap, and how can we do this together? So I think EMRA takes the lead, reaches out, we sit down face to face at least once a year with all of these groups and try to figure out what's the best way for us to do it together while remaining our own, independent voice of our membership to the organizations that need to hear that voice. So it's kind of a balance, but I think we're pretty good at that. Actually, it's a strength of ours.
Okay. So finally, I would like to thank you again for your time. Hope in the future there may be collaborative opportunities between EMRA and even the residents in Taiwan.
That would be awesome. We would love that. We actually have a division of EMRA that's dedicated toward international and global medicine. I'm sure that we should talk at the end of this about plugging you guys into that. That'd be really great.
Okay. Thank you.
Yes. Thank you so much. Of course. Thanks.